Now, every year from the 24th to the 30th April, World Health Organization, UNICEF, and all health partners in Nigeria join the global community to celebrate World Immunization Week. This year, under the theme, Vaccines Bring Us Closer, the World Immunization Week urges greater engagement around immunization globally and at the country level to promote the importance of vaccination and to improve health and well-being for all. As COVID-19 vaccines are being rolled out worldwide, including Nigeria, Dr. Tunji Funsho, a former cardiologist and now the chair of Rotary International's polio eradication program in Nigeria, joins us for more insight about Immunization Week 2021. Dr. Funsho, good to have you join us.
Thank you for having me on this program.
Yes. Now, I don't mean to sound negative, but I want to sort of start from lessons learned. Considering we've been around this, or we've been on this journey before with polio, where, do you say, conspiracy theories stopped a group of people from having their polio vaccines and the resultant effect. Should we not have learned our lessons? And this time around, should we not be referencing those lessons in terms of advocating for vaccination across board with the COVID-19?
You are very, very correct in that assertion. I think one of the lessons we have not learned over the last, I will say, 3 to 4 centuries is actually preparing people's minds, for this kind of event. The polio event was not the first in history. There has always been opposition by some, minority of people against vaccination. There was the 300 years ago in Boston, Father Mather, who, through the services of one of his slaves, discovered, that you can inoculate, people with scabs, from smallpox, sufferers, and get them immune as a consequence. Had, a bomb thrown into his house, which unfortunately did not, which fortunately did not explode. So it is not new. And somehow we get caught up in the same, kind of situation where we really have not communicated adequately. When I say communication, it's not about, whether it's English or Hausa or Yoruba. Everyone has their soft spots for how you can communicate with them, and they will appreciate it. We're doing a lot of town hall meetings now with the traditional leadership and political leadership in virtually all the states in the country, spearheaded by the National Primary Healthcare Development Agency. This is what we should have done whilst we're anticipating the arrival, of the vaccine. I think if there's any lessons we hope we will learn finally from this issue of vaccine hesitancy is to actually, do these communication efforts and advocacy efforts well in advance of the arrival or the beginning of any mass vaccination campaigns.
Well, a world where no one dies of a vaccine-preventable disease is a world we all hope to live in. Unfortunately, that's still a mirage. Let's talk about the impact of COVID-19 on routine immunization in a country like Nigeria. Can we quantify that impact so far?
Well, we don't have the correct figures, but we know that quite a number of vaccination campaigns, particularly to do with measles, as announced by the Director General of WHO, about 60 campaigns, had to be halted, because of COVID-19. And as far as our own pet, project is concerned, polio. We had to suspend all activities until July last year, when we resumed campaigns, for those, particularly, because of the outbreak of vaccine-derived poliovirus, mostly, in the West African, sub-region and parts of, East, Africa and the Horn of Africa. So there has been, that aspect, but also there has been reduction in the number of, parents and caregivers who are making their kids available at primary healthcare centers, because one of the fear of COVID-19 at the beginning, exposure, And secondly, because most of the government resources were focused almost entirely on COVID vaccine, vaccination. So we've had a setback there. It was just salt on injury on a routine immunization coverage that was very, very poor to begin with.
Okay, still on the trajectory of lessons learned with regards to polio, is it fair to say we're relatively on top of that situation now compared to what it was like before? And then with reference to that, since we didn't have advanced communication like you advocated for, what do you think was the secret or the key to our getting on top of the polio outbreak?
Yes, I think we can, sleep easier now in Nigeria as far as the polio virus is concerned. As I always told people, previously we were sleeping with two eyes open. Now we can afford to sleep with, one eye, closed and one eye open, just to ensure that the virus doesn't come back through the back door. And so our slogan now is keeping polio at zero in Nigeria by ensuring that we support and encourage increase in routine immunization coverage from the current level of less than 50% to at least 80-85%, when we can be certain, even if the virus finds its way here from the only two countries that still have the wild polio virus circulating, that no child will ever be paralyzed again by the polio virus. I think one of the major game changers in Nigeria is communication. And communication, like I said, through the right sources. The involvement of the traditional leadership and to some extent, religious leadership have been a game changer in convincing people that the vaccine is safe and the vaccine is efficient. Most importantly, that the vaccine is safe. Our traditional institutions are very robust, from the state level to city level to local government level up to ward level. As a matter of fact, when we go out on immunization campaigns house to house, we have the local traditional leader usually accompanying us to particularly those areas where there are vaccine hesitancy, just to encourage people to take the vaccine and assure them that the vaccine is safe. So that was a huge leap, for us. As soon as we got most of the traditional leadership at every tier of the structure of traditional leadership in this country involved, encouraged, motivated to accept the vaccines, they have been a great supporter of the immunization campaign in the country. Of course, one cannot, remove the political will that was brought to bear on the campaign from the national level and also from the state level by the federal government and the state governments, both in terms of putting as much resources as possible into the campaign, but also, showing example by they themselves ensuring that their children are publicly or grandchildren are publicly immunized. I think those were areas, where we communicated appropriately. I wish we'd have done that earlier and much more tenaciously before we started having some of those vaccine reluctance.
Okay.